Now, previously, we talked about the muscles, and when we were talking about the muscles, we talked about the extrinsic muscles, which were actually originating from the forearm, but they were serving their function at the level of the wrist joint, metacarpophalangeal joint, and proximal and distal interphalangeal joints. And now we're going to talk about some more muscles, but those muscles would actually arise, or you can say originate from the hand and insert into the hand and exert their function in the hand as well. So these muscles are actually known as the intrinsic muscles of the hand, and they are also divided into three major categories. One are the thenar muscles, the hypothenar muscles, and the deep palm muscles. So let's start off with the names of the muscles which are in these three groups. So talking about the thenar muscles, so this area is actually the thenar and this is the hypothenar. So the muscles in the thenar would obviously be acting more at the thumb. So in the thenar muscles, we have the flexor pollicis brevis, we have the abductor pollicis brevis, and we have the opponens pollicis. So these are all muscles which are acting at the thumb. One is the flexor of the thumb, one is the abductor of the thumb, and one is causing the opposition at the thumb. Similarly, hypothenar is on the medial aspect, and it is actually concerned with the little finger or the fifth digit. So we can say these muscles would be acting on the little finger. And as you can see from the name, flexor digiti minimi, abductor digiti minimi, and opponens digiti minimi. So similar to the muscles of the thenar, they have the same name and exerting the same functions at the little finger, which is flexion, abduction, and opposition of the little finger. Then at the end we have the deep palm, which has muscles deeply located in the ventral aspect or the palmar aspect of the hand, including the adductor pollicis, interossei muscles, and the lumbrical muscles, including we are going to talk about them in detail in the upcoming slides as well. So as I already mentioned, the thenar and hypothenar, as I already mentioned, this is the thenar and this is the hypothenar. And as you can see in this picture over here as well, this one on the aspect of the thumb is the thenar eminence and this is the hypothenar eminence. And this eminence is because of the muscles which are present in this region. So starting off with the thenar muscles, as we already mentioned that there is a flexor, there is an abductor, and there is an opponents causing the opposition of the thumb. So first of all, the flexor pollicis brevis muscle, and that is the origin of the flexor pollicis muscle, as you can see in this picture, is from the trapezium and the flexor retinaculum. Flexor retinaculum is a connective tissue structure which actually forms the carpal tunnel with the carpal bones, and that we're going to talk about in detail later on. But talking about the flexor pollicis brevis muscle right now, so the origin is from the trapezium and the flexor retinaculum, and the insertion is in the proximal phalanx of the first digit or the thumb. The action is that it flexes the carpometacarpal joint and the metacarpophalangeal joint of the thumb, and the nerve supply is via the median nerve through C6 and C7 nerve roots. The second muscle is the abductor pollicis brevis muscle, which causes the abduction of the carpometacarpal joint of the thumb, and the origin is from the scaphoid trapezium and the flexor retinaculum once again. So the insertion is once again on the proximal phalanx, similar to the flexor muscle, and the nerve supply is once again the median nerve with the same nerve roots, which are the C6 and C7. And then at the end we have the opponens pollicis muscle, which causes the opposition of the thumb or the opposes the thumb at the level of the carpometacarpal joint, and the nerve supply is once again by the median nerve and the same nerve root, which is C6 and C7. So the origin is once again from the trapezium and the flexor retinaculum, as the same as the flexor muscle, and the insertion is at the first metacarpal, as you can see here. So there is the difference in insertion here, because the previous two muscles were inserting into the proximal phalanx of the thumb, but here this is not reaching the proximal phalanx but actually inserting in the first metacarpal. Now, on the other hand, we have the hypothenar muscles, which actually serve as the muscles of the little finger and performing movements such as flexion, abduction, and as well as the opposition. So first of all, we have the flexor digiti minimi muscle, and as the name suggests, it is involved in the flexion of the little finger at the level of the carpal metacarpal joint, the metacarpal phalangeal joint of the fifth finger. So the nerve supply is why the ulnar nerve, because it is present on the medial aspect, and the nerve roots include the C8 and T1, and the origin is from the hamate and the flexor retinaculum, and the insertion is at the base of the proximal phalanx of the fifth finger, similar to the insertion of the flexor muscle of the thumb, which was also on the base of the which is also on the proximal phalanx of the first digit or the thumb. So as you can see this here, so both of them have the pretty much same course and same orientation, but on two extremes, one on the medial and one on the lateral side. The other is the abductor digiti minimi, similar to the abductor pollicis brevis. The function is to abduct the metacarpal phalangeal joint of the fifth finger, as you can see here, and the origin is once again from the pisiform and the tendon of the flexor carpi ulnaris, and flexor carpi ulnaris is one of the extrinsic muscles which is coming for arising from the medial epicondyle, and it comes here and actually acts as a flexor of the wrist and also causing ulnar deviation at the wrist, and it is actually arising from the tendon of that muscle as well, along with the pisiform, and the insertion is on the proximal phalanx of the fifth finger, similar to the proximal phalanx of the first digit for the abductor pollicis brevis, and the nerve supply is once again by the ulnar nerve, and the nerve roots include C8 and T1. The last of the hypothenar muscles is the opponens digiti minimi muscle, and as the name suggests, the function is the opposition of the fifth finger at the level of the carpometacarpal joint, and the origin is from the hamate and the flexor retinaculum, whereas the insertion is into the fifth metacarpal, similarly to the opponens pollicis, which also had its insertion into the metacarpal instead of the proximal phalanx. The nerve supply is once again the ulnar nerve with nerve roots C8 and T1. Now we have talked about the thenar and the hypothenar muscles, and there are some other muscles which include the adductor pollicis muscle, the intraossea muscles, as well as the lumbricals, and these muscles constitute to form the deep muscles of the palm. So first of all, we have the adductor pollicis brevis, and as you can see, this one is the abductor pollicis brevis, and the adductor actually abducts or takes the thumb away, whereas the adductor brings it back. So that is the opposite in function to the abductor pollicis brevis. So talking about the adductor pollicis brevis, so its origin is from the capitate base of the second metacarpal and the palmar surface of the third metacarpal, and its origin is in terms of the base of the proximal phalanx of the thumb, same as the proximal phalanx of the thumb for the abductor pollicis brevis as well. The action is that it adducts the thumb at the level of the carpometacarpal joint, and the nerve supply is by the ulnar nerve and with C8 and T1 nerve roots. Now talking about the lumbrical muscles in the deep muscle group, so the origin is from the tendon of the flexor digitorium profundus muscle, which is once again an extrinsic muscle of the hand coming from the forearm, and insertion is on the tendon of the extensor digitorium muscle, and the function is that it flexes the metacarpophalangeal joint, whereas it extends the proximal and distal interphalangeal joint, because it arises from the palmar aspect and moves towards the dorsal aspect for its insertion. The nerve supply is that first and second lumbricals are supplied by the median nerve, and third and fourth lumbricals are supplied by the ulnar nerve via the nerve roots C6, C7 and C8. Talking about the intraossea muscles, we have the dorsal intraossea and palmar intraossea. So we have four intraossea for the first, second, third and fourth. So talking about the first intraossea, the proximal attachment is the first and second metacarpal. For the second intraossea is the second and third metacarpal, and for the third intraossea it is the third and fourth metacarpal, and for the fourth intraossea is the fourth and fifth metacarpal. So as we can see that the second and third, both of these intraossea actually have their attachments with the middle finger or the third metacarpal. And similarly, if we talk about the distal attachment, so for the first dorsal interossea is the lateral side of the index finger. For the second is the lateral side of the middle finger. For the third it's the medial side of the middle finger, and for the fourth dorsal interossea is the medial side of the ring finger. So we have two of these muscles being attached or acting at the middle finger. Their function is to abduct the fingers, and for the first it is to abduct the index finger, for the second is to abduct the middle finger laterally, for the third it is to abduct the middle finger medially, and for the fourth it is to abduct the ring finger. We do not need dorsal interossea for the little finger because it has the abductor digiti minimi for that function. Talking about the palmar interossea, we once again have four interossea. So the first interossea has the proximal attachment at the first metacarpal, and its distal attachment at the medial side of the thumb, and it adducts the thumb. So as compared to the dorsal interossea, the palmar interossea is adduct the digits, whereas the dorsal interossea abduct the digits. The second palmar interossea has its proximal attachment at the second metacarpal and its distal attachment at the medial side of the index finger, and it adducts the index finger. The third palmar interossea has the proximal attachment at the fourth metacarpal and its insertion at the lateral side of the ring finger, and it adducts the ring finger. And the fourth palmar interossea has its proximal attachment at the fifth metacarpal and its distal attachment at the lateral side of the little finger, and it adducts the little finger. So another important structure anatomically when we talk about the hand is the anatomic snuff box, which is formed as a depression. As you can see here, this is my anatomic snuff box, and it is formed by the tendons of the abductor pollicis longus muscle, the extensor pollicis brevis muscle, and the extensor pollicis longus muscle. So medially it's the extensor pollicis longus, and laterally it's the abductor pollicis longus and the extensor pollicis brevis muscle, and they form actually the anatomic snuff box, which is actually located here. So that's all about the intrinsic muscles of the hand. I hope you learned something new out of it, and keep on watching sqadia.com for more lectures like this. Thank you very much.